morning there, YouTube. This is Maria again, or Maria Makes Moves. This is October 9th. It is my 9th day on my pre-op liquid diet. My surgery is a week away. A week, 7 days, next Tuesday. It's becoming real. So excited. I don't know, it still doesn't feel real, but it's becoming real. I've had a lot of things going on since the last time I made a video, so I guess we'll talk about that. Oh, let me first start with numbers. Hello. So I started, before my pre-op diet, which was October 1st was the first day, I started my weight at 296. Um, Yesterday I had my last pre-op, I guess, education class, which went over a couple of exercises, what to expect post-op, more in depth. And I officially weighed at 288, so that was a 6-pound loss within 8 days. 8 days. So I'm really excited about that. I'm really happy about that. It's kind of amazing that 8 pounds in 8 days. So I'm super excited. I've seen the scale actually have gone down to about 285, which would make that a 11-pound loss. But the scale fluctuates. Depends on what time of the day it is. In the morning I weigh less. Like this morning I saw a 285.6. So I mean, by later today it'll be back up to about 287, 288 again. So I don't know what the real number is, but 288 official weigh-in. So excited about that. So yay. Don't mind my look today. It's disgusting this morning in New York, so I'm not really caring about my hair, and I'm about to leave for school, so I don't care what it looks like. Okay, so let me talk about what I've had done so far. So on the 3rd, October 3rd, which was the 3rd day of my pre-op diet, I went for pre-testing. And for those of you who've, done one of the procedures, and this is all review stuff, you know about this, but those of you who are just looking into the weight loss community, trying to give you as much information as possible. So getting lap band done on October 16th. I should probably mention that, shouldn't I? So October 16th, I'm getting the lap band done, so I had to go for pre-testing on the 3rd. Pre-testing included a urine sample, which was super easy to give. Usually I'm like a timid, I don't know, I just can't pee in public. I have a shy bladder, I guess you can call it. And with this pre-op diet, as soon as I drink a shake or drink a water or have any kind of liquid enter my body, I have to pee within like 20 minutes, like clockwork. Like it's so predictable that I need to excuse myself to ladies' room like 20 to 30 minutes after I drink a shake. So yeah, I had to give a urine sample, blood work, and just a regular physical, and they kind of gave me oh my god, so much paperwork. I have everything in a binder now. I'm super organized. I'm one of those weird people. So, let me go into what they gave me. Okay, so they had to, obviously I had to show my insurance cards, all that fun stuff. Okay, the downside, I guess I'll start with the ugly stuff first, is they gave me a proxy to fill out. It's optional, that's always, that comes with any surgery, big or small. So, of course, I've delayed to fill that out because who wants to fill that out? Yeah, so I'm sure I'll be a mess when I take the time to look at that, but I'm trying to not look at that for a while. So I had to discuss with my parent all that stuff that you really don't want to think about, but they make you think about it, and it will probably give me a lot of anxiety, so I don't want to think about it yet. I'm sure there's nothing to worry about, and I'm one of those people who probably freak out, but it's still real. They're handing you paper to fill out, so it's still real. It's in black and white too. The next thing they give about is instructions, which my paper looks like this, and there's a list of I don't know how many things, probably like 20 things that I have to follow before surgery. Obviously you can't eat or drink midnight the night before, smoking or having alcohol, don't wear makeup, no nail, surprisingly no nail polish, so I have to make sure I take my nail polish off. I'm guessing just to check the oxygen levels, and a good sign for that is through my finger color, my nail color. Um, they gave me a special, they told me to shower the night before and shower the morning of, and they told me to shower and shampoo as regular, but they gave me a specific um, thing that I have to use after I shower. So like I would shower normally, any kind of my regular soap and water, shampoo, whatever, body wash. But then I have to use this um, afterwards. So I have to kind of I guess apply this and then rinse it off the night before and the morning of when I shower. Obviously no contact lenses, I don't wear that. Dressed in loose-fitting clothing, body piercings. I have a nose ring, I don't know if you can see it, so I have to take that out. I have a couple of ear piercings I have to take out. They told me the reason that it's because I'm hooked onto a whole bunch of, machines, and electricity is obviously running the machines, so they don't want to, something to happen where it burns because my piercings are made of metal, so obviously I'll be taking that out. That's about it. They told me that, what room to go to, floor, um, yeah, and they gave me a sheet about the different types of anesthesia, so I'm prepared about that. Oh, and then they gave me this slip about visitation in the PACU. So, which I'm kind of upset about, but family can only visit me 5 to 10 minutes, and only 2 at a time, which I'm sure all of my family wants to come visit me because they think big Italian family, everyone wants to come visit you. So that should be kind of interesting. So 10-minute intervals. I don't know how that's gonna work. Yeah, and they gave me kind of like the day of surgery what to do. So from arrival time to admission to like step by step, you're gonna be seeing the nurse, and the nurse is gonna do this and this and this. So that was kind of interesting to get, and I appreciated all the you know instructions for that. And I think that was it for my pre-testing, besides, blood work and urine sample. Very smoothly. Everyone was so nice to me at the hospital. I'm at Staten Island University Hospital North, so I recommend they've been so patient in answering any question I've ever had. Okay. Then let's see. What else? What else happened? Oh, my education class. So at the education class, I don't know if I mentioned this in the last video, they gave me a prescription for pain meds, um, just for the week, and they say most of the patients don't even use the whole week's worth of pain medicine. So I have it just in case I need it. They also gave me a script for an upper GI, um, a, exactly a week after surgery, so 2 weeks from today, just to make sure that the placement of the band hasn't moved since, and making sure that it's the way they want it and all that fun stuff. And I guess I'll talk about the education class. So yesterday was my education class. I told you I had my last weigh-in at 288, and she told us about pretty much the exercises to do to get rid of the anesthesia in your body the quickest, which is what I'm kind of nervous about also, because I don't like anesthesia. So she gave us this little device. I'm sure everyone has seen this before. I thought you had to like breathe into this and then it goes up, but it's the other way around. You have to inhale, and as you inhale, this white thing goes up to where it's supposed to be measured out for you. And I'm at about 2,500, and that depends on your age and your height. So 2,500 is for me because I'm 23 and I'm 5'5". So yes, I have to inhale and get the little white piece up to 2,500, which is really hard to do pre-surgery, so I can't even imagine how it's going to feel post-op. Also, deep breathing exercising and coughing exercises, so that should be good. Um, that was pretty much it for the education part of it, besides, the entire info packet, total information once again from start to finish that I've been doing for over a year. So it's a lot of repetitive information. Um, Trying to think, what else did she tell me? Oh, they won't release you from the hospital unless you can get 3 ounces in of, be able to swallow 3 ounces of liquid, so water or juice or something that they give you at the hospital. They start you off at, it's every 4 hours, and you're supposed to have four within those 4 hours. So they start at 1 ounce. So hour one, 1 ounce. Hour two, 1 ounce. Three, 1 ounce. Hour four, 1 ounce. And then hour five, they start all over again with the 4 hours, but they move you up to 2 ounces, and that continues until um, you can do 4 hours worth of 3 ounces. So, and they told us to give us a little chart to measure because, I'm sure I'll forget being under all that medicine. So I'm excited about that. I feel really prepared. I'm not nervous. Um, my liquid diet it almost feels like a lie when I say that I haven't cheated, because it's kind of, I can't even fathom just having 6 shakes a day, then like Jello and Crystal Light. It doesn't seem real to me, like I've been able to do that. But I have, and I haven't cheated on it. I mean, I've been tempted, um, because my body just, I feel like I need a solid food in me, and I crave it. And I mean, I'm surrounded by food all the time. This past weekend, I went pumpkin picking with a group of friends, and we went out to dinner, and I'm sitting there with my little shake, and everyone's eating, whatever they want. So I mean, definitely been tempted, um, but I'm like really happy and really, I'm surprised at myself. I'm proud of myself that I haven't cheated. Um, so yeah, that has been a struggle. I mean, I like, if I see the food, I think it's more mental. If I see it, I want it. If I don't see it, if I'm busy, I'm totally satisfied with my shakes. Oh my god, this hair looks disgusting, and I can't tell what side it's on. Okay, whatever. Anyway, so that's been going well. I don't know what else to talk about. Um, I think that's about it. So again, this morning I weighed 285 point something, but officially 288 as of yesterday. I think I'm going to get a new scale, just because mine's really old, so I don't know if the fluctuation is normal or maybe it's just my scale, so I'll get a new scale. um, really excited, again, a week away from surgery, and can't wait to start that. Yeah, that's about it. Um, I think that's it. So message me with any questions, comments. I love getting the feedback. It's great just to get, keep up the good work. I mean, just really all excited about that and joining the community, and I've gotten in contact with a lot of great people. So thank you for all the messages so far and comments so far and subscriptions. And I've met a lot of new people through YouTube following their journey, and a lot of newcomers. So it's excited to see that, and I think that's it. Okay. Talk to you probably, I would say, the day before surgery. I'll probably make another video on the 15th, so I guess I'll see you then. Okay. Bye. Have a great one.